Good evening, everyone, and welcome to the Long COVID Clinic, What You Can Do, with me, Dr. Binita Kane, and
myself, Helen, Oakleigh, representative of the charity Long COVID Support.
Really looking forward to this evening's chat, and I'll be introducing our guest in just a second. But as always, a reminder that the session is live and interactive, so we encourage you to put your questions into the chat, and Helen will be keeping an eye on those backstage, and we will try and answer as many as possible towards the end of the session. The session is recorded, so if you can't make it all the way through to the hour, there's plenty of opportunity to watch it back as well. So without any further ado, Helen, I'm going to wave goodbye and see you in about 40 minutes, and I shall bring our guest on stage. So a massive welcome to Dr. Raouf Gharbo, who is Director of Autonomic Rehabilitation at Virginia Commonwealth University. Thank you so much for joining us all the way from across the Atlantic.
Thank you. It's a pleasure to be here.
Thank you. So this is going to be a really popular session, I think, and I know there's huge numbers of people with long COVID who have sleep disruption who are going to be very interested in what you have to say. But I thought it would be really helpful if you could give us a little bit of background about how you got interested in long COVID, because your background was actually in traumatic brain injury, wasn't it?
Yes. So I'm a specialist of physical medicine rehabilitation, and I'm also board certified in neuromuscular electrophysiology. I am the director of Autonomic Rehabilitation here at Virginia Commonwealth University. However, today's are my opinions, not the university's, and I have no conflicts. But I've become fascinated with this biomarker called heart rate variability, which we'll talk. And it is basically a function of the parasympathetic system. I use the word parasympathetic because that's the recovery system. The vagus nerve is the route to the recovery system, and the recovery system, when do you recover? It's predominantly 90% of your brain rinsing and repairing is at night. So nocturnal heart rate variability for me is a core feature. And in 2020, I published Autonomic Rehabilitation, Adapting to Change. Words mean a great deal to me to help shape how people think. For instance, all of our studies at VCU are around persistent sympathetic activation. Persistent as a...
So, Raouf, I'm going to just stop you for a moment because you've said a lot of big words there, and there are, so our audience is a lay audience. They may not understand exactly what you're talking about. So I'm going to just strip it back a little bit. But just before we launch into the autonomic rehab and what that means, what is the autonomic nervous system, just tell me a little bit of background about you, because you used to work with traumatic brain injury and rehabilitating people with brain injury, and that kind of segued into your work in long COVID. How did that work?
So rehabilitation physicians are a jack of many trades, and I'll say to people, you went to this specialist and they said kind of not really, this specialist kind of not really, and they end up with somebody who knows a fair amount about neurology, some cardiology, some pulmonology, some orthopedics. And I think that's how this naturally came about to me, since long COVID affects so many different things. Virginia Commonwealth University Rehab Department happens to be the hub for the entire U.S. military concussion research consortium. And so that's our strength. And so I do see a lot of concussions, and people will notice that there is a relationship between the two. It's not necessarily a significant amount of brain injury. It's this being thrust into nonstop, persistent threat mode, which is our default. Our default is to survive, not to thrive. And so that is a very powerful state, but it's not efficient. So it's exhausting. So that's the correlation. So people get concussions, 90% of them spontaneously recover. So those 10% that are not recovering, what's going on there? And there are some similarities between that and long COVID. And I believe it's this persistent threat mode that's powerful but inefficient, and you get stuck. Much like PTSD, you get stuck hypervigilant and exhausted at the same time.
Okay, so that's really interesting. So you were seeing, you rehabilitate a lot of soldiers who will have had lots of different injuries, lots of different body organs, and you were seeing some similarities with what happened with your concussion patients and what you're now seeing with long COVID. So let's talk about this threat mode. So the autonomic nervous system, we talk about it a lot on this live stream. It comes up in nearly every session I do because it's so core to what's going on in long COVID. And it's the system that controls all of our body's automatic functions, isn't it? Heart rate, blood pressure, digestion, breathing, you name it, anything that's going on in the background, this is the system. And you talk about threat mode. Just talk me through that in a little bit more detail, just to remind people what we're talking about.
Right. And I like to do automobile analogies and so you have gas and a brake, and we're high performance vehicles. So they are independent levers. They're not, we drive with one foot to keep it simple so we don't mess up. But you do need to think of it as throttle and active braking. And so when you're in the fight, flight, or freeze, you are pushing the throttle and you keep things simple. You're in a part of your brain. I'm either going to punch, I'm going to run, or I'm going to pass out, play dead, to survive the moment. And people are stuck in this part of the brain, which is the central autonomic nervous system. So concussions, infections, emotional trauma can keep this stuck. And some people have a harder time to recover. So you'll notice some people with hypermobile collagen are more susceptible to autonomic problems. I don't tell them that that's the cause, but that's probably the reason why you didn't spontaneously recover from your concussion or your COVID infection. So it is persistent threat mode. When you sleep, you should be parasympathetic, actively parasympathetic recovery. So sleep is active repair. That is a critical concept. It is not hibernation, although if that's what could be going on with long COVID, you're not actually actively repairing at night. So if you're stuck in threat mode and you're not getting adequate recovery, your braking system may be gnarled. So your sleep may look like this when it should look like this. And
okay, so I'm just, one of the ways that we try to sometimes describe this to patients is that these are systems that are part of all animals, right? That come from our evolution. So animals are designed to have this threat mode so they can run away or fight, or as you say, play dead, just to get out of danger. But the idea is there's a huge amount of energy and effort that goes into that survival. And then when the threat disappears, everything should calm down and go back into rest mode. So we could talk about sympathetic, fight, flight, freeze, or parasympathetic, which is rest and digest. And what you're saying is people get stuck in this sympathetic fight, flight, freeze, and they can't row it back, particularly at night, which is when you should be in that healing, repairing, parasympathetic mode. Have I got that? Have I articulated?
Yes, and it requires two things. And I have a very strong opinion of the order. One is it requires active withdrawal of threat, and it requires engagement of active parasympathetic tone. So two things have to happen. I believe when you're stuck for repair, you engage the parasympathetic, you get good at this, and this is where the breathing techniques come in. And then we do work on withdrawing of that. So I break it down that's our goal, is to get your sleep look more like this. And it takes two actions in order.
Now, right at the start, you dove straight in with heart rate variability, HRV, which is something you're really passionate about, something I'm really passionate about and didn't know much about before getting into the world of the autonomic nervous system. So let's break down heart rate variability. Now, a lot of people watching will kind of know what this is. They'll be monitoring it via their smartwatches, via the Visible app. But I think there's a difference between what people understand is HRV, what we understand as nocturnal or nighttime HRV, and the importance of those two things. So can we delve into that in a little bit of detail?
Sure. I call this my 80-60-60 explanation.
Okay.
Think of heart rate as a measure of load. I'm going to do this action and my heart rate goes up, hopefully appropriately, but many of our patients, they do a small action, the heart rate goes up. That is telling us about the heart rate. Heart rate variability, you can loosely think that's vagal, that's variation from beat to beat. What is the biggest varier of heart rate, if you will? It's the diaphragm. So now you have a biomarker of the relationship between the heart and the diaphragm within the chest canister. So we know for sure that someone with a heart rate of 80 versus a heart rate of 60, the person who sleeps at 60 is likely more fit, more resilient, and there takes less energy to do the work, the active work of sleeping. And so they're more resilient. So exercise improves resilience, period. Does not improve flexibility and adaptability, just resilience, if you will. Can you handle more of the same? But we have to go a step beyond, and the biomarker of how do I adapt to this new state is heart rate variability and the relationship within the diaphragm. So now if we look at two people with heart rates of 60 at night or 80 at night, okay, and somebody varies at night between 58 and 62, and somebody varies between 50 and 70, both at 60. We know that the diaphragm is helping bring in air and blood, speed it up, slow it down, varying heart rate. So this ends up being a marker of how much how strong the diaphragm is, how rhythmic the diaphragm is, and a measure of adaptability. So then we do dozens of different calculations, and it comes up typically in milliseconds. And so that's a number. So you may have, with your concussion or your COVID infection, gone from here to here and did not spontaneously go back. And so when you start tracking, and let's pretend and there are countless metrics, but let's say it's RMSSD in milliseconds and your number is 20. It's a reflection of this. And so if you have 3 nights or more in a row and it's 10, you haven't done your active, and the relationship between the vagus nerve, parasympathetic system, the diaphragm, HRV. I tell people, this is loosely, but this is your mitochondrial pit workers at night. They should be actively repairing. If you have a trend lower than your average, you haven't done your mitochondrial housekeeping. And so it becomes extra cautious day. And so that helps with pacing as well and measuring how restorative your sleep is. But that is based on the assumption that you're getting enough sleep. So I have to first find out if somebody has a good circadian regulation. I have to make sure they don't have obstructive sleep apnea. I have to make sure that they don't believe that they can get by with 6 hours of sleep and nap a couple times a day. I validate, your 10 hours of sleep and still being exhausted. It's because your sleep isn't active.
Okay, so
it's not harming you to sleep a lot.
Yeah, so I think people are maybe going to struggle to follow some of those concepts because we're talking about some quite complicated physiological concepts now. So I just want to break that down again, if I may. So you're talking about heart rate variability. You talk about heart rate, which is, everyone understands heart rate. As you go faster, you do more, your heart rate goes up. Heart rate variability is the difference between each beat, and that should vary slightly with every beat. And if you've got a really nice, springy, resilient autonomic nervous system, which is responsive, I'm lying down, I'm standing, I'm doing stuff, and my body's responding appropriately, my autonomic nervous system's working really well, your heart rate variability is high, it's good, it's working fine. But in people who get stuck in this kind of long COVID or concussion or infection or whatever it is, the heart rate variability becomes lower, and they're less efficient in their resting and repairing. Is that?
Let me see if I could. Let me see if I can clarify. One thing I like to say is, your diaphragm. You have an autonomic software problem, and your diaphragm forgot to do what it's supposed to do.
Yes, the diaphragm is the muscle between the chest and the abdomen, and it should go from this domed position to a flat position when you breathe in and out. And that changes the pressures in the chest. It helps suck blood into the heart, and it's really important.
So in your canister, if you're only relying on your heart rate to speed up, if you have a diaphragm that is both strong and big rhythmic excursions, it's a secondary pump. The more the diaphragm is working, the greater the HRV, the greater the amount of blood it can suck in and push out. So in your heart, chest, diaphragm canister, you want a strong and rhythmic diaphragm, and the software controlling that at night, HRV goes down, which means the diaphragm isn't working. So you're going to need a HRV breathing technique to try and reintroduce that software to get that going. You want the diaphragm helping when you exercise because you want to be efficient, to not go anaerobic. So it is, for me, the starting point, the relationship, and kickstart the diaphragm in a strong and rhythmic first, then strengthening. This is very complex.
It is complex. And I think there's a few comments coming in that people are a little bit confused. So just very, very simply then, HRV and how the diaphragm is working are very intimately related. And overnight, if the diaphragm is not working very well, and that is to do with breathing pattern, that can affect the quality of sleep. And your HRV will be low, and it's not promoting that rest and digest part of the nervous system where repair takes place. So I think these are all linked concepts, aren't they? Low HRV, poor diaphragm movement, non-restorative sleep, and then non-recovery.
And the way that connects with the brain and the recovery systems is you can create the physiological mechanisms of recovery. But so we do research also on what I will call brain rinsing, the lymphatic trickling between the cells and rinsing the brain. And that is created by big hydrostatic pressure changes. We know that it's the diaphragm that creates those big cerebrospinal fluid flows and shifts for brain rinsing. So we want that strong and rhythmic diaphragm when you sleep as well, to improve brain rinsing, if you will. And brain rinsing is almost all done at night. It's not all done in one night. So I try and tell people things repair when we can get a few months of restorative sleep. And so that's the connection you're creating with the breathing techniques, vagal tone. You're also strengthening a rhythmic diaphragm, and that connects with, if you will, brain rinsing, and strong diaphragms are the driver.
I think the fundamental thing, if people did not follow any of that physiology at all, which is very understandable because it is complicated, the diaphragm is a pump, which is key to rest and recovery and restorative sleep. And if you think about the fact that all night long we are breathing automatically, if that is happening in the wrong way, we don't have conscious control over it.
Right.
That could be hampering recovery. So your approach is really entirely based at the start, isn't it, on kind of correcting this
Right.
Is that fair to say that it's entirely based on that at the start?
This is not your sleep scores. So the conversation first is you need your days and nights. The human being needs a good circadian rhythm. Your sleep scores are based off of wrist movements. Those are just dividing the stages of sleep. I need to make sure you're getting enough sleep before we even talk about heart rate variability.
Okay, so here's my Aura ring. Some people will be wearing the Polar, some people are wearing Garmin, some people are wearing Apple Watch, and these things are measuring amount of sleep, but they are not and they might even tell you. So my Aura ring tells me you've got this much deep sleep, you've got this much REM sleep, but it doesn't tell me the quality of that sleep. Is that right?
So that's wording again. So we've known for decades that fibromyalgia, they have non-restorative sleep, they have less deep sleep. So they have less quantity of deep sleep. And then some people make the next step, that means non-restorative. But I have people who still have adequate amounts of these deep sleep stages, but their HRV isn't any good. So they're in deep sleep, they're just still not accomplishing much. So you have to get enough sleep. I have to make sure that, and then we can talk about understanding how active the repair is. And so that's what heart rate variability is. It's a measure of how active your repair is.
Yeah, so there's lots of people who go, I can sleep for 10 hours, I can sleep for 12 hours, and I wake up and I feel horrendous and I don't feel refreshed. And that's such a key quality of what patients describe to me in my clinic. So you talked earlier about a few different approaches that you have to think about when you're assessing patients. So you have to make sure that their circadian rhythms are okay. So I don't think we've got time to go into that in detail, but just for anyone who doesn't know what that is, circadian rhythms are about going to sleep when it's dark, waking up when it's light, and being tuned into that natural 24-hour kind of sleep cycle.
The simplest way is small naps early, as long as they don't interfere with your full night's sleep. So early short naps are fine. Don't let it interfere. Don't take a long afternoon nap and interfere with your sleep.
Yeah, and I think people get a lot of conflicting advice about that. So some people will be told, no, like do not sleep during the day because it's going to affect your nighttime sleep. Or, they're told get up at the same time every day, go to bed at the same time every day, sleep hygiene. And I don't think there's clarity around what's the right thing to do.
I think naps are great. I think you should take them. Just your barrier to that is don't have it so much that it destroys your night. But your active repair is reduced, and when that nighttime HRV is really bad and the patients come back, I tell them it's good news and bad news. It's validating to you that you're not accomplishing much at night. It's made the invisible visible, and it's validating. It's what I expected. So don't look at it as bad news.
Yeah. Okay. So that's something you look at. You presumably do a sleep study, make sure somebody doesn't have something called sleep apnea, which can impact on quality of sleep. Again, we don't have time to go into that today. So you'll do all of these screening things to look at what's getting in the way of good sleep. But fundamentally then, if you recognize somebody's got low HRV, maybe during the day they appear to be using their diaphragm okay, how do you start going about retraining this at night? Because to me, it seems really counterintuitive. I'm asleep, I've got no conscious control. How do I start correcting this? Like, what do you advise people to do?
So first of all, I know a lot of people are concerned about brain fog. I personally like the term cognitive fatigue and cognitive impairment. If I can elicit a history from you that under optimal circumstances for a short period of time are you still sharp even for a short period of time? That could be good news, saying you may not have a tremendous amount of cognitive impairment. You may have an enormous amount of cognitive fatigue. As we address the various versions of fatigue, cognitive fatigue, post-exertional malaise, all these chronic fatigue, as we address fatigue, so non-restorative sleep for me is the sort of the pinnacle symptom, and nocturnal HRV is above that. And if we start addressing the fatigue, before we get any kind of neuropsych testing, let's address the cognitive fatigue, and let's see how much afterwards, how much cognitive impairment you may or may not have. 3 months of decent sleep is life-changing, and brain rinsing. And so let's put cognitive impairment on hold, and let's address cognitive fatigue.
Okay.
Yeah.
So, but just going back to the diaphragm and nocturnal HRV, how do you get people to retrain the diaphragm to improve that pump, to improve the parasympathetic, to improve HRV, to improve sleep? That's kind of what our goal is, right?
Right. So if your diaphragm has forgotten to do what it's supposed to do at night, you need a daytime practice, and that is what's called resonant frequency breathing, and that is like homework. You could do 10 minutes twice a day. The second time just before sleep, because you want the diaphragm doing what you want it to do as you fall into sleep. And here is what I'll say to keep it simple. It's 5-ish seconds in, 5-ish seconds out. This is critical. No breath holds, no breath holds, no breath holds, no breath holds. Because before we work on diaphragm strengthening, which is what breath holds do, we want to pull apart rhythmicity and strengthening, and we want to put rhythmicity on top and strengthening second. And so it's with proper diaphragmatic technique. So if you have a friend that's a singer or a yoga instructor, they can teach you how to use your diaphragm. So it's 5-ish in, 5-ish out, no breath holds, proper diaphragmatic technique. We know 10 minutes twice a day for 6 weeks is like transmission, like brake fluid. It creates a little easier for you to get parasympathetic at night. It is
this is really critical, right? This is a really critical point. So I'm just going to, sorry to interrupt you. I'm going to pause it there because I want to emphasize this point. It's this resonance breathing. So people will be familiar with this in different forms. If you have the Visible app, your resonance breathing is on there. Okay. People will have come across it in other ways. I'm going to put a little caveat in there that if you've got a very dysfunctional breathing pattern and nobody's looked at it yet, you might actually struggle with a 5-second in and a 5-second out. So a step before trying to do resonance breathing is resetting basic breathing pattern. And we'll be doing some stuff on that on this channel at some point this year.
Thank you.
But say, for argument's sake, someone's basic breathing pattern is okay, then simply doing 10 minutes twice a day for 6 weeks of resonance breathing. And we're not talking hyperventilation. We're talking quiet, gentle breaths, 5.5, 6 seconds in, 5.5, 6 seconds out. 10 minutes twice a day for 6 weeks is scientifically proven to improve HRV.
Oscillations, rhythmicity is the key. That rhythmicity creates these fluid movements for rinsing. You're absolutely correct. So for healthcare providers, I said, well, one basic thing is someone breathing correctly? And so the algorithm should start, do they have disordered breathing at rest? Do they have disordered breathing when they sleep? And then the huge thing, we do a lot of exercise tests, and we see what's one of the things that comes up is disordered breathing with exercise. So again, these are the beginnings of what I call autonomic rehabilitation. Let's first find out if you have disordered breathing at rest, sleep, and exercise. If you can tolerate that breathing, simply a prescription of that will improve parasympathetic function. If you're stuck with thought ruminations and you can't break free, adding biofeedback equipment can help you learn the skill of shifting. And we showed that that is a skill that you can learn and still have months later. And so So that's what's called heart rate variability biofeedback. So resonant breathing is simply with a metronome. I'm going to practice this 10 minutes twice a day or whenever I'm overthinking. But if I need equipment to feel that shift, which here's a critical insight over the years. When people do this and they have POTS or so forth, and they feel lightheaded and uneasy, in some of these mindful clinics, they'll then move on to acupuncture, things like that. I make a very important point here. You've been stuck in persistent threat mode. If you breathe with the diaphragm like this, it is a substantial physiological shift, and your brain may interpret change as threat when change is actually recover, and you will over time need to feel, you'll have to hear my explanation that your heart hardware, your lung hardware is fine, and that this is triggering the threat response, even though it's recovery parasympathetic. And you will want to gently, here's another critical, it is mandatory, but not urgent, that you get comfortable with this over time, or we figure out why.
So just to try and translate that again a little bit, sometimes the changing of the breathing pattern can trigger a bit of stress if it's not done in the right way, and then it can then promote that stress mode. So I guess that goes
and
back
lightheadedness. They feel uncomfortable with it, lightheaded.
Yeah. So this is kind of what some people who are trying to do the visible breathing are finding. So on the Visible app, there's a kind of a coherence breathing kind of facility on it. And some people are finding that makes them feel worse. And I suspect it's because they've not reset their underlying breathing pattern properly. And they're trying to do too much too soon. The breath, there's 5.5 breath in and 5.5 breath out is too much. And then you're actually doing a little bit of harm rather than good because you're not being coached in the right way.
So this is essential. Yes, this is for all you people struggling with that. You're not in a hurry. If it's a bad day, it's a bad day. If you can't do 5.5, start with 3, start with 4. But it is my opinion that this is something you must get comfortable with to be able to achieve where you want to go. But it is, any sense of urgency will make it even worse. And you have, if you've had your cardiac workup and your pulmonary workup and they say your hardware is fine, this is safe, right? I have to put qualifiers on all recommendations I put out there, but I don't with this one. This is healthy, period. But you also need to hear that it is unsettling, very unsettling.
Yeah. I think it has to be done with that self-compassion, that kindness to self, and, to be okay if you're finding it difficult, row back, go a step lighter, to take things more slowly. This is about patience, time, and effort and investment, because I think the more you put into this kind of work, the more you'll get out. And that's a really difficult balance for some patients because they're so fatigued and so overwhelmed with everything that's going on that actually finding the mental and the physical effort to even commit to doing something twice a day is too much. So I think I say to people, please just be kind to yourself. Don't put too much pressure to say I have to do 10 minutes twice a day. Anything's better than nothing. And just build it really, really slowly.
And if you've had autonomic testing, you'll know you did this breathing. This is the most parasympathetic breathing practice. So I know the data is on my side because it's the definition of parasympathetic tone. And that's how they assess. If it's low HRV, there could be hardware problems.
So I'm going to give you a little anecdote now, Raouf, because a few weeks ago I had a couple of really stressful days. And then there was one night I had this horrendous night's sleep. I woke up at 2 o'clock in the morning and then I was awake till 5 o'clock. But during those 3 hours, because I know that doing diaphragm breathing helps you get back to sleep, I pretty much lay there and did diaphragm breathing for about 3 hours, which I don't think I've ever done before. And then the next day I was expecting my HRV to be horrendous because I hadn't slept. I'd had a couple of stressful days. And it was way up. And I was like, wow, that's so fascinating. You're all getting an insight into how sad my life is now. I was like, whoa, this is so exciting. But I was really amazed that, you know, lying, and I've just for clarity, my breathing pattern's been horrible all my life because I had really bad asthma as a child. So I'm working really hard on correcting that at the moment, and it's making a difference. But yeah, it was really quite interesting how just doing, and it was basically doing resonance breathing for 3 hours during the night, just sorted my HRV out the next day. Quite amazing.
And you're a lung specialist.
No idea about this stuff. We don't get taught this stuff
Right.
at all. And, you know, we get taught how to treat lung disease. We do not get taught how to breathe for health.
Hardware. You're a lung hardware specialist, and I have to reinforce that you know, the testing in your situation, et cetera, the hardware was okay. You have a software problem, and oscillations or rhythmicity is the starting point.
So when you're talking hardware and software, I'm just going to clarify this for people. You're talking about, you know, I don't have a lung problem. My lungs work fine. My heart works fine. It's more about the wiring and the mechanics.
And how they work together.
It's like, how is it programmed? How are these programmed to kind of work efficiently and breathe efficiently for health? That's what we're talking about.
So my hypothesis is many people have glitchy autonomic software, not repairing at night, worsened by persistent threat mode. And my patients get that. And I said, it's going to be about that. Obviously, if they have a hardware problem, we have a treatment plan for that. But glitchy autonomic software, not repairing at night. So HRV is the metric for that. And the breathing is shifting or modulating out of the threat mode. And what are the things that are keeping your threat throttle down? And so someone commented about propranolol. So some of the medications that we use lift the throttle. So I get people first to do the breathing, okay, and get used to that. And then we may help them with a propranolol that lifts the threat throttle. When it comes to, I'm a huge believer of the energy conservation theories, spoon theories, all those, that once you accept that, so I'm not a huge proponent of cognitive behavioral therapy. I'm more about accepting the realities of the human physiology and physics. And so I believe accepting that I don't have the energy to get into needless arguments, even though I'm right. Once you accept that, it's a little less threat throttle. And so I get people to accept the really hard physiological things. And one of the rules, I call it the 2 and 20 rule. If you're allocating your energy to needless things, your brain is 2% of body weight, but can burn 20 or more % of its energy. So emotional conflict, beating yourself up, somebody else judging you. It's not whether it's valid or not. It's whether or not that's an wise allocation of your precious energy. And having tachycardia during the day. So when you are wearing the monitor and it says you have tachycardia, well, if I'm going to save my child from getting hit by a car, it's worth the energy. But if it's winning a political argument with my neighbor, or, so propranolol and things like that can dampen the heart rate. So you're not wasting energy on simple things. And you want to save your energy for the people you love, the things you need to do. I want you to save it for your mitochondrial pit workers at night, right? Because you don't want to overwork them. The other thing I want to make sure I throw out there to accept. So accept your brain is huge and consumes a ton of energy. But the other is that when you go anaerobic early with activities, it's 14 times less efficient. So this is why they have you exercise, keeping up with oxygen. When you're using oxygen, you're aerobic. And so if you go anaerobic and you sprint upstairs, you're going to have more work for your mitochondria to clean up at night.
Yeah. So, I mean, I think there's so much you've just said there that, again, maybe not everyone's following everything. But I do think there's some really key concepts I'd like to bring out before we move on to questions, because suddenly we're 40 minutes in. But this kind of sympathetic, the fight flight response people are stuck in. You're saying that, it can be triggered by physical stress, emotional stress,
meals.
There's so many different triggers, like food. It's evaluating all of that, and I'm very much about that holistic approach, because there's always emotional stress triggers going on in everyone's lives, like regardless of what chronic illness you've got. And it's trying to modify those in a, again, kind, compassionate way, and not wasting your energy on stuff you don't need to waste it on. I just love that. and being okay with how things are and working with it, and then working that acceptance piece is really important. So we haven't probably got time to go into all the aerobic, anaerobic lactic acid stuff, but we have covered that on previous live streams. If you're interested in learning more about that, we'd watch the one with Todd Davenport, the one with Robin McNellis, and we've talked a lot about that in those sessions. But what I'm going to do is just bring Helen back on stage so we can start with some of these questions and answers. Hi, Helen.
Hey.
So there's been a lot of chat. So let's
thanks so much, Raouf. It's really useful, and great information. Cognitive dysfunction is strong in me today, forgive me. So there was a few questions in the chat. There was some that came in direct as well. I also have some questions, so I shall mix them all up. You mentioned towards the beginning about collagen and hypermobility, and I was curious, because we've not touched at all in this session about my focus is always, what can you do as a patient? It's great to understand the science behind it, but the reality is there's a limited amount of minutes per day where you've got the cognition to actually do something about it. So what can we do with those precious minutes to make a change, and trust that the science is accurate from professionals like yourselves, basically. So with that in mind, is a collagen supplement or food that's high in collagen, is that something that would be recommended, or
those have not, there is not clear anything close to being clear there. I think the supplements that consistently show up are CoQ10 for energy, L-carnitine, alpha-lipoic acid for nerve health, vitamin D, zinc, omega, magnesium. And then I'm a big stickler on making sure B12 is the most important vitamin for nerve health, that you don't accept a low normal B12, that you probably want to have it. I tell people to get it checked every year. And the American norms are lower than the European norms, and you want to be closer to the European norms. And a lot of people don't. So I'm getting B12 right, making sure of that. I think the energy conservation theory is where it's at, because it's never about whether you've been judged as not trying hard enough, but the opposite is true. You're overthinking, you're trying very hard. And you, instead of talking about smart or weak, any of those, is this worth my energy? And it changes everything when you start getting in the habit of, is beating myself up or someone else emotionally, is that worth the energy? And it's hard, even if you deserve to be validated and you're not. At least maybe nocturnal heart rate variability, I tell them, it tells me your sleep stinks. We knew that, but now we have a number. And so acceptance is a huge route to not wasting energy. It is a huge paradigm shift from other psychological models.
Yeah, great. On another practical note, in regards to the breathing, so it's breathing in for 5, breathing out for 5. Can I just have clarification? Is that nose breathing or mouth breathing? Because I mean, I'm come from a background as an actor and director, so I'm used to it being in through the nose, out through the mouth. That's, you know, very much what you do. My bread and butter. But is that?
There's always idealism in practice. Yes, that is the way. But you know, if you need to introduce rhythmicity and you have nasal obstruction and you got to do it with your mouth, the point is rhythmicity. But yes, you're tweaking it correctly. So I definitely, this is the most physiologically parasympathetic breathing. And if you are stuck in thought ruminations, I highly recommend heart rate variability biofeedback to modulate that.
What is that, Raouf? Joe, so can I just come in quickly? I always recommend nose breathing because it's more efficient generally, and you know, it's better for you, and it's more parasympathetic, stimulating the mouth breathing. So if possible, nose breathing. But can you just talk about what is biofeedback? Because you've mentioned that a few times.
Let me add to what you're saying. One of the research engineers, when we talk about brain rinsing and so forth, you'll be interested to know 50% of the things that are drained from the head go through the neck. The other 50% are via the nose. And there are oscillations in the nose with vessels. And so once again, oscillations help. So yes, breathing in the nose, through the nose, absolutely. And it may actually be an indicator. Okay, I don't want to create too much, but it is conceivable that could be an indicator of dementia, not being able to expel things through the nose. But heart rate variability biofeedback, some of these devices have that. It's the difference of whether you're breathing with a timer, that would be resonance. Biofeedback is you're clipped to your ear, you're clipped to your, now you're getting information and calculations are being made, and you're going to cause a device to ding or bloom a flower or go green. That's heart rate variability biofeedback. And with a coach, it's life-changing if you are stuck in threat mode, both physiologically and emotionally.
And are there sort of devices that are these just in the research setting, or are these things that you can just go and buy off the shelf?
There are several, $200 and less biofeedback. There are $5 apps where you can put your finger over the camera. Now, it isn't the easiest, but for $5 or $10, you can put your finger over the app and it picks up your pulse and it will calculate resonance and coherence and so forth off of your data.
It's effectively giving you real-time live feedback on how effective you are in your breathing technique.
And you may stink one day because you're overwhelmed in some ways or another, but it's reinforcing. And again, you have to be kind, right? If I'd done decent on it for 3 days and I'm terrible today, that you keep it in context that this is a sensitive marker of when things are starting to go poorly.
Yeah.
So step one in autonomic rehabilitation is tracking nocturnal HRV. Step two will to predict high risk days, and then step two is what do I do to change it? And that would be resonant frequency breathing, maybe with the biofeedback. And then the third is in the context of an energy acceptance-based model.
Yeah. And on a very basic, I've forgotten the word, thing, I would just say as a general tip from a patient point of view, if you might forget, you can send reminders on your phone. And something that I've been doing lately, which has been a game changer for me, is literally hanging up fobs. And then I move them from one hook to another. And then I know that I've done that thing. And that is as basic as taking pills, making a meal, whatever it is. Do you know what I mean? Like the real basic things, and then you know that you've done them, and you can include fobs for doing 2 sets of 10 minutes breathing, for example. Then once you get into that habit, then you won't need the fobs as much, but it's about starting small and then building it up.
You want it to become a default. Whenever you're mentally or physiologically overamped, you can lower your heart rate by engaging your diaphragm. So you want to become an expert recover into sleep or after being triggered. If you're fortunate to live and be around somebody who's supportive, one of the things I will do is, look, I want to unload your coaching responsibilities. I want to be your coach. I want you to be your Socratic partner. Socrates didn't tell anyone what to do. He only asked questions. So when they see them breath holding when they get anxious, that's a huge thing, a default you have to rewrite. Breath holding. I can't. And so you ask them in a caring way, is now a good time to breathe? Oh, are you stuck in the future? Are you stuck in the past? Posing it in a question is less threatening and is helping you create that habit. You want resonant breathing to be your default before a pill, before frustration, and you won't get it right. I still break that. But when you want to have a centering physiological default as opposed to threat.
Yeah, and breath holding, I'm a terrible breath holder when I'm working, like when I'm doing emails and I'm on screens, I just don't breathe. And I've become much more conscious of it recently. But you know, it can be just it's a sympathetic response. You know, anyone has a shock, it has, you know, or that, you know, that it's a sympathetic response.
Do we have time for one more analogy?
Go on. We've got lots more questions, but go on very quickly.
I call it, it's important. This breath holding is such a big deal. And I talk about powerlifters and distance cyclists. A power lifter is going to breath hold to create tremendous power to lift. It doesn't care how inefficient it is, but they are at risk for passing out. Breath hold, stop the diaphragm is very powerful. You want the diaphragm to keep moving. So you want to become a distance cyclist through all your emotionally difficult conversations, through climbing some stairs. You want to breathe. Don't tell anyone to take a breath because they'll take it and hold it. You want to breathe through everything with a rhythmic. Now, obviously, a cyclist can't slow their breathing down that much. But if you're a cyclist, wouldn't you want a rhythmic secondary pump? You would never breath hold, and you wouldn't want so you want to breathe through everything. You want to go from a power lifter dealing with everything you read and hear about to becoming a distance cyclist.
I'm going to just thank you for that analogy. I'm going to just bring this question up because I think it's quite pertinent. So Leanne's asked, you know, so if the breathing pattern's good, no obvious stress, why might HRV still be low?
This is what healthcare providers struggle with, this biomarker. It is ultra sensitive to a problem. It is not specific. It is horribly specific to a single problem.
Yeah.
So it is your whole health metric. And so I'm giving you the first thing to work on, but literally thousands of things reduce your HRV. So if you know, a beautifully orchestra, right, that has, there's a lot of things going on, and all it takes is one person on a trumpet or this or that, and all that rhythmicity. So yes, that is the conundrum. Long COVID, I like to say, is like a handful of sand. Most people, you throw that sand on the hood, they drive away. Or if I throw all that sand in your brake fluid, the doctor says, you got sand in your brake fluid. But if I sprinkle it in all the different parts, and somebody says, yeah, but you got a little sand there, it's not enough for all the complaints that you've got. So this is exactly it. It is saying something is wrong, but that is what we still have to solve. The several other things that are going on at the muscle, carotid body, the brain. Exercise testing can tease out some of that. But yes, there's still dozens of things.
Yeah, and I think one of the other things that we need to remember is that the autonomic nervous system is 90% controlled by the subconscious and hardwiring from all of our previous experiences and thoughts and things that have happened to us in our lives. So
let me give you two quick examples. One person was very diligent. The Canadian wildfires affected the United States. They moved their air purifier from the hallway to the bedroom, and their HRV went up. Another person, they had a bowl of gluten soup one night, and their HRV tanked for 3 nights. So if you're disciplined, but don't overthink it, you can figure some things out.
Yeah. So it's everything, isn't it? It's your environment, it's your gut, it's what you're putting into your body, it's how you think, it's your previous experiences. So another little example I can give you, something happened to me a few weeks ago. I'm just on a fairly high level meeting. People know I'm not shy of talking in public. I do it all the time, but I put my hand up to speak at this meeting, and it was kind of a bunch of people I don't really know very well, very high stakes kind of meeting. And my heart rate just shot up. And I was watching it come on my smart app going 100, 110, 120, 100. I was like, why is it doing that? And again, I was really fascinated. It's like, wow, my sympathetic nervous system's just completely kicked off by putting my hand up at this meeting. I don't know why. That's come from somewhere deep inside, probably somewhere in childhood. And there's all these little triggers that are just hardwired in us. Even I was consciously not anxious at all. So it was really interesting.
Yes, it's subconscious. It sounds like it was a particularly important meeting and a particularly important comment to be heard. So its importance level was really high, and it may have been worth it, even in retrospect. But you can also, with the biomarker, recognize, well, I was in a texting argument last night at 10 o'clock and my number's low. Maybe that wasn't worth it.
Yeah.
But you're describing something that was important and emotionally worth it. And you would still make the same decision, but you still did learn a lot. That no matter this is your field of expertise, that the threat.
Yeah, and a lot of people say to me that my body feels anxious and my mind doesn't feel anxious, and that's kind of the POTS. It's the dysautonomia. It's the illness, right? And they keep being told I'm anxious. I'm not anxious, but my heart rate's going. And
yes, so what I say to those people, they're great at top downing, meaning they're making the right decisions up here and their body's still in threat mode. So let's decide take the diaphragm and let's get better at creating parasympathetic tone in your chest canister. And so that's one end. They're great top downers and they've left their body behind. The other way to look at that someday, that I think part of PTSD training and counseling will be, is can you talk about really scary, difficult things while you keep your body parasympathetic? So someday I think heart rate variability biofeedback will be part of PTSD counseling. Can I keep this breathing and this device green while we think and talk about something scary? And in that case, in your case, that's what you were trying to do. You would want to resonant breathe while you're waiting to be called on.
Exactly what I did. And it did. Right. It brought my heart rate down.
Right. And so let me keep this calm, even though it's a stressful up here, and mastering the two, deciding when it's important. You decided it's important. Let me keep this calm until I'm called on, and let me not waste energy. Let me waste heartbeats. Let me help my heart out with my diaphragm. And those little insights are life-changing. And breath holding will make things worse.
Yeah. And that's very similar to acting as well. It's about making sure you're not holding tension, making sure that you're relaxed, you've got enough oxygen in. And of course, going forwards, next time, make sure that you've eaten healthy beforehand. If you're loaded with sugar opposed to more natural energy sources, then that's going to impact as well. But in more severe POTS cases, if you've got those conversations, being seated will help opposed to standing up. Like, it's near impossible for me to stand and talk, but I can seated, it's okay. But it's how do you get to the next level?
And what are you going into that day? So your nighttime HRV, I don't get worried about one night. It's threat. So the rule for me is 3 or more nights. So the morning before that meeting or acting, if I've been below my baseline 3 nights in a row, it's a high risk. So I can't be sloppy at all with my thoughts and my actions if I want to succeed today.
And I think it's important to highlight that this this concept of HRV is not limited to long COVID or it's for anyone actually, and it's for any chronic illness. It's a brilliant biomarker to live your life by. And biomarker is something you measure over time that reflects, changes.
What one perfect example is cancer. It is a biomarker for all cancers, any stage. That is a ridiculous comment. And at first, a healthcare worker would say, you're crazy. But let's look at two people with the same cancer, get the same chemo, and get the same radiation. The person who is doing their brain rinsing, their inflammatory rinsing at night, the surveillance is better, they will have a better outcome. So that's why it could be used for cancer outcomes. It can be used for many different things if you play by its rules, which a lot of companies don't play by its rules.
Okay, I mean, we are sort of at time, but Helen, was there any other sort of, if you're happy to hang on, Raouf, just for a few more minutes, would that be all right with you? I'm conscious of your time.
Yes,
yeah, we can maybe stretch to a couple more. I'm keen not to run over by too much.
Yeah, there's so much more that we could cover. Julia put in a question a long time ago, so I will cover that if you're able to bring it up for me, please. She said it would be nice to hear their opinion on how this relates to POTS, blood thinners and beta blockers, whether there is anything specific in this context.
I use the same approach for concussion. I should say the starting self-efficacy. There are different medications and different secondary, but the starting approach for my concussion, long COVID, POTS is learning how to track your restorative sleep with HRV. Then I teach them how would you modulate it. It would be with the breathing, and then the third, let's frame it with accepting the laws of energy and incorporating that in your life. And that starting point is, and it would be the same as well, dealing with somebody who's struggling with cancer symptoms.
Yeah, I'm the same. I will always have a holistic approach to any medication. So, beta blockers, ivabradine, they can give you enormous symptom relief. They can reduce that threshold at which you go into that oxygen debt, and they can make a really big difference. But my goal is always to get people off these treatments eventually, because they do all the underlying work to reset the physiology.
So I do prescribe quite a fair amount of beta blockers and pyridostigmine. I do, but I usually introduce that after let's get you doing this and learning how to do this. Now let's dampen the heart rate or let's pyridostigmine or those sorts of things.
I'm going to just bring up this question. So this is someone who's saying that they do the coherent breathing on the Visible app, but HRV is often lower. Now, I'm not sure the Visible app monitors HRV in real time. It only measures it once a day via the armband or by the finger. So I'm wondering if we're confusing heart rate with HRV here. So heart rate, you would expect to be lower at the end of the 5 minutes, because if you are doing the breathing, you should be triggering parasympathetic, and it should be lowering the heart rate. So HRV, she said that there, HRV is normally lower. So I don't know how we're measuring the HRV in that case. I'm a bit confused maybe by the question.
Yeah, I'm familiar with the app, not all the details. There are several ways to answer that, but bottom line, if you're practicing, you're improving rhythmicity, and you're still, it's still of value. It's conceivable. Your diaphragm could be fatigued at the end of it. So there's a lot of different potential explanations, but the practice and the habit and the default are healthy, period.
And heart rate being lower is a really good sign at the end of the practice. It shows it's worked. And there can be other little signals as well, a little bit of saliva in the mouth, or tingling, and just these other signs that the parasympathetic nervous system has been triggered.
You want to become an expert decelerator of your heart rate before sleep, after triggering, after exercise. You want to be an expert at that.
Thank you, Denise, has corrected me in my incorrect statement there. I said it doesn't measure HRV in real time. It does, apparently. So thank you for that. I didn't realize it did that. As I don't use it for that reason. So that's interesting.
Yeah, but I will say that app has been very good.
Yeah.
That app's been very good for my patients who I thought were moment to moment aware during the day, and it has said their height rate spikes up, and they have allocated. There's some very nice features to that.
Yeah, and I guess it's also important to not pay too much attention to a single HRV reading over a couple of minutes, because really especially during the day, because that might not reflect overall sort of HRV. Is that fair to say, Raouf?
Ask that again.
So if someone's done some breathing on visible and they've got an HRV measurement in real time, that will probably only be measured over a couple of minutes as opposed to over a whole period of time. So it may not really be reflective of the whole picture. Does that make sense?
You got to be careful with over interpreting any 2 or 3 minutes of anything. So
yeah, exactly.
So you just have to be careful. It's profoundly important for you to gain awareness. But one of the problems, this is there's life's idealism and pragmatism. This is an extremely powerful, useful, pragmatic tool. You can learn things, but there are times where there's just too many variables and you just need to, okay, well, let's not overthink this.
Yeah, so Reese has also said that there's a graph at the end, which is interesting. But yeah, I guess, the idea of nocturnal HRV is that it's measured over the entire night and then averaged out, whereas something like visible will be measuring it just over a couple of minutes.
Right. So in the morning, it checks morning HRV that is used in perfectly healthy athletes, and it is a very pragmatic choice. I think a decade or two from now, we want to know the size of your gas tank you're filling at night. We want to know your deepest HRV during deep sleep. There's a whole couple dozen more parameters, science idealistic wise, we want. But this is a ultra pragmatic, very useful tool. And 2 or 3 minutes in the morning may be helpful. It may be also helpful to track your whole night's HRV and then use the Visible app to help you pace during the day so you don't get those high heart rates needlessly throughout the day. But speaking 10 years from now, when we have the tools and everything, yes, there's going to be a half dozen night HRV data points that will be useful in different ways.
Yeah, and there's lots of different ones available. And I'm a great fan of the Garmin Active Vivo 4 because that was out way before Visible. And as the first UK citizen to officially get COVID, I've been doing this a long time. So I found that so useful. But then the Aura Ring as well,
Right. With Garmin, they hide and they rename stuff and they call it body battery and they won't tell you exactly how they calculate. And so body battery is fine. It's close enough. That's fine. But it's mostly HRV. But if I want to be super cool, I'm gonna make you not exactly know how I made the calculation. I'm gonna call it body battery. But conceptually, body battery is a fantastic concept. Again, it's energy based. It's mostly HRV, some heart rate. But yeah, we don't have the perfect tool right now, and it might take different ways to look at it.
Bottom line, if you're finding it useful and you're seeing patterns and then you can base your behaviors based off that, great. Carry on doing
Absolutely. And I think topically, so I think this is going to have to be the final question. I'm just conscious of people's energy levels and yours as well, Helen. So is there anything available to monitor a child's HRV? Visible app is for adults. So a lot of the kids in our clinic use the Garmin Vivo Smart 4. I'm not here to promote products, but it's the body battery actually works extremely well for children because they understand phone battery. And they understand this concept of battery, and they seem to engage with it. And the fact that it doesn't constantly ping and give alerts all the time is really helpful as well. So that's the one that our kids tend to use. I don't know if you've got any other suggestions.
No, that's the concept, is that they have to value their recovery. That is the behavioral change. They're now valuing their recovery. And yes, in 5 or 10 years, it'll be more of a medical device, and we'll be more transparent of what body battery means. So my little arguments with that are as a academic person, but not as a pragmatist. That kind of thing is extremely useful in the real world.
Lovely. Okay, so I think I'm going to have to call it a day there. I mean, it's been a really good discussion. I know it was really technically challenging for people. I hope that we've managed to get the key concepts across, and just remains for me to say a massive thank you to Raouf for joining us, Helen for using your spoons as always this evening, and for everyone watching, and for being such a brilliant, engaged audience. As usual, I've not prepped very well to tell you who's next on the channel, but we've got a couple of really great sessions. I think it might be Amy Proal actually, but a couple of great sessions coming up in March and April. So I will see you next time.
And also a reminder that the 15th of March is Long COVID Awareness Day. So there's lots going on around that. If you log on to the website longcovidsupport.org, you can find lots more information there. Google it. There's lots of amazing charities as well, out there. Please engage with whatever ones you can, and awareness will help research, which will help treatments, which will help us. So it's all good. And thank you to everyone who is working hard as part of that in whatever capacity, the two of you, of course, and everyone else. It's all so much appreciated. So yeah, thank you.
Thank you. It's been a
Thanks
pleasure.
very much, everyone. Good night.